junior doctors across the country are set to withdraw their services on Tuesday in protest over months of unpaid salaries. The doctors who say they've been left stranded and frustrated despite countless assurances from government insist they can no longer bear the financial burden of working without pay. The decision could further cripple the already struggling healthcare system, leaving patients in dire need of care at risk. Let's get into the details of their statement. We'll also speak to the doctors very shortly. And they're saying that the Junior Doctors Association announced that its members will embark on a nationwide withdrawal of services following months of neglect and unfair treatment of some of its members. Over 200 junior doctors have worked for 10 to 14 months without salaries. Moreover, several medical officers who were previously on payroll have had their salaries stopped without explanation. We also have over 800 medical officers who have been awaiting posting for the past 1 year, 4 months. Despite repeated engagements with authorities and goodwill shown towards the government, no solution have been offered. The Junior Doctors Association therefore directs as follows: that all members should withdraw all outpatient services effective Tuesday, 7th October to Thursday, 9th October 2025. And secondly, withdraw emergency services effective Friday, 10th October 2025 until further notice. However, inpatients will continue to be managed until discharge, but no new cases will be admitted. The association wishes to make it clear that the continued exploitation of junior doctors will no longer be tolerated. The responsibility for any disruption of healthcare services lies squarely with the Ministry of Health and the government of Ghana, and they're calling on all stakeholders to act immediately to resolve the issues. So joining us now is Dr. Louisa Nkrumah. She's president of the Junior Doctors Association. Dr. Louisa, we're grateful for your time on our desk. Well, how long have you gone without pay yourself? What's been government's explanation to you?
All right. So we have our members who've been working for more than a year. Some have been working for the past 1 year, 4 months, and that's 1 year, 6 months. In fact, the latest a person has not been paid is 1 year, 6 months, and they've been working without salary. We've worked with all the agencies trying to find a solution, but we haven't had any. There has been no payments of salaries, hence the initiative we've taken.
What's the explanation government has given to you? Who have you seen? Is it the Minister of Health or the Ghana Health Service or what? Who have you talked to?
Okay. So we, as part of our lectures right now, aside the press statements, we also wrote to the ministry on all government stakeholders. Over the past couple of months, this did not start now. We've been engaging together with our mother association. We've been giving them a lot of pressure. We've been engaging the Ghana Medical Association, Ministry of Health, Ministry of Finance, Controller Accountants, and our salaries have not been paid. This is unacceptable. 1 year, 6 months, 1 year, 4 months without payment of salary should not be done, and hence the initiative. We also have our members who've been at home, and we also have our members who've been working. They were on payroll for a while now, and they have suddenly had their salary stopped, truncated. Initially, it was a month, 2 months ago. We decided to, solve it amicably, but still, we haven't had any response. And last month, we also had more, not even the previous one, more of our doctors' salaries being stopped.
So, Louisa, how are you managing? You've not been paid for about 14 months, at least, according to your statement. How are you surviving? So this morning, tell me.
Look, I have some of my members. I have a member call me. This is a lady who was posted. She was posted to a district that she had no idea about, but she decided to go. She called me and she told me that she has to eat once a day to be able to afford transportation to work. This is unacceptable. We have several others. I also had another doctor call me that his landlord walked to the emergency he's working in to demand payment. This shouldn't happen in Ghana, and this shouldn't happen at all.
So you're saying you're going to withdraw outpatient services on Tuesday?
Yes, we are.
Yes. How will this impact services when you're not there?
Okay. All right. So junior doctors, there's about roughly 6,000 doctors in Ghana. Junior doctors make about 4,500. We work most of the time. We manage most of the patients because the others are usually our bosses. So we form the majority of the workforce. So from Tuesday to Thursday, we are going to withdraw all OPD services. From Friday, if we haven't heard anything, we are going to withdraw all emergency services.
So help me understand, Louisa, when you go to the hospital, what do you do? What's your work? How is withdrawing that going to impact services? Let's relate to it.
Okay. So when I said junior doctors do a bulk of the work, when you go to the hospital, let's say you go to Parliament or you go to Confirmation, let's say Confirmation. The first doctor that sees you as a junior doctor is a house officer.
Right.
Who will take your history, make all the plans, and who will take your history together with their bosses, who can be a medical officer or even a resident or probably a consultant. And most of our medical officers are also junior doctors themselves. So they are the ones who form the plan for the patients. If they need to take your samples, if they need to give you medication, prescribe medications, if you need to go to surgery, most of the medical officers, especially in the district hospitals, those affected the most are the ones who are working in the rural and district hospitals. Some are actually manning one hospitals. It's a one doctor hospital where the entire hospital is only one doctor, and he's doing everything. And what that's probably supposed to be done by about 50 doctors, he's the only one doing it because it's in a deprived region. And for this reason, if you don't pay such a person, what message are you sending to other doctors coming up?
So Louisa, if this happens, that means it's going to affect healthcare, obviously.
Oh, yeah.
Yes. So emergency services are also going to be affected, you say?
Yes.
Wow. Have you had any, you've written the statement, has the Minister of Health seen this statement? Have they spoken to you even this morning?
No, we haven't received any message from them. We are still waiting for them to respond.
Right. So I would like to know what then will be, how long can you maintain this stance you've taken?
Okay,
if there's no response.
Can I ask you a question?
What do you want to say?
Okay, please, your name again.
Mamiesi, yes.
Okay, Mamiesi, in the work you are doing right now, if for 1 year, let me make it 1 year, join me stop paying you, will you continue working? And you decide to stop working, and they come and ask you without payment of salaries, how long do you plan on not coming to work? What will be your answer?
It wouldn't be a good thing to do, but that hasn't happened to me. Now you're the one we're talking about, so let's go on that tangent. Yes, so,
no.
Yes. Yeah, so go ahead, I'm listening.
That's exactly what I've told you.
Yes. So what I want to know, exactly, you've made that point clear, and you say you're withdrawing your services on Tuesday and on Friday when you don't hear anything. And I'm asking that if the ministry doesn't respond, how long can you maintain that? Are you not going to return?
Very well.
You're not going to return until your salaries are paid?
No, we are not going to return until salaries are paid. And please, like we said in the letter, the blame is squarely on the ministry, not on us.
What other alternatives will patients have if you do this?
What other alternatives?
Yes.
I believe the government should respond to that, not us. Look, we are all in Ghana. Imagine being operated on by a hungry doctor, a doctor who doesn't have money to eat. Would you want to be operated on by that doctor? A hungry doctor is not going to be an efficient doctor. Just pay them their due, pay them their salary. That is all. Someone can't work for 1.5 years and you will not pay them. It's unacceptable. So let's stop all these legalities and let's just face the facts.
Right.
Just pay our members, that's all.
All right. Louisa, I have on the line with us the spokesperson for the Health Ministry, Tony Goodman, to give us some updates on your concerns. Tony, we're grateful for your time on desk. This is what the doctors are saying. I don't know if you have received their statement of their notice to go on, withdraw their services, outpatient services specifically, on Tuesday. They say they've not been paid close to 14 months. What exactly is the problem?
Thank you very much, my sister. Let me say good morning to our sister listeners. Actually, this was just some mess up. Their issue was resolved some months back. But we in the ministry are even surprised that they have not been paid. So as I speak to you, we're currently resolving it. We are aware that their financial clearance was given some few months ago, and we have done what we have to do. So, see,
Yes.
I can tell you that this is not a problem at all. Louisa, I can assure you that this will be dealt with. We have actually identified where the challenge is coming from. I'm sure they were put together in one of the areas we did not accept, we didn't want them to be. But unfortunately, they are there. So we are currently resolving it. So just be rest assured, we'll deal with it.
So you say the issue is being resolved. How soon will they receive their monies?
Oh, the soon will be at the end of the month. The soon will be at the end of the month because, as I speak to you, I said it's a mess up. We thought they have even received their salary. We've currently resolved that. We've invited their mother association. We've also spoken to them. We are on the same page. They've also seen the effort put in. And then I'm sure this will not be one of the usual, what do we call, assurances. But it's being resolved. It's being resolved.
Right. So, Louisa, the attorney saying that your issue is being resolved, is this satisfactory enough? Will this let you withdraw, take back, or not go on this withdrawal of services from Tuesday?
Contacts are out there. If the ministry really wants to assure us, they can pick up a phone call and talk to us. And we want it on paper. Verbal assurances are nothing. It doesn't hold water. We want it on paper that we are going to be paid. That's all.
Right. Thank you, Louisa Nkumahi. She's the president of the Junior Doctors Association. We also heard from Tony Goodman. He's the spokesperson of the Health Ministry on this. And that's